What are the main treatment options for urinary incontinence? Have you ever wondered how urinary incontinence is treated? This common condition, characterized by the involuntary leakage of urine, can be managed through various options. The right choice depends on the type, cause, and severity of the incontinence. Let's explore the main treatment options available. First up are behavioral and lifestyle modifications. These are often the first steps in treatment. They include bladder training, which helps establish a regular schedule for urination. Scheduled voiding can also be helpful, along with managing fluid intake. Weight loss may reduce pressure on the bladder, and avoiding irritants like caffeine and alcohol can improve symptoms. Pelvic floor muscle exercises, commonly known as Kegel exercises, strengthen the muscles that control urination. These exercises are particularly effective for stress urinary incontinence. Next, medications can play a significant role. Various drugs target bladder muscle activity or urethral function. For those with urge incontinence, antimuscarinics or beta-3 adrenergic agonists can reduce bladder muscle spasms. In postmenopausal women, topical estrogen may improve the health of urethral and vaginal tissues. The choice of medication will depend on the specific type of incontinence and individual patient factors. Medical devices are another option. Urethral inserts and pessaries can provide mechanical support to prevent leakage in cases of stress incontinence. For individuals with neurogenic bladder dysfunction, clean intermittent catheterization is a common practice. This method helps empty the bladder regularly, preventing leakage or retention. Injections and nerve stimulation therapies can also be effective. Botox injections into the bladder can help reduce contractions associated with urge incontinence. Nerve stimulation therapies, such as sacral neuromodulation or tibial nerve stimulation, can modulate nerve signals to improve bladder control. When conservative and medical treatments are insufficient, surgical options may be considered. Male urethral slings are a common surgical treatment for men with mild to moderate stress incontinence, with about 80% experiencing symptom improvement. For more severe cases, artificial urinary sphincters can be used. This device involves a cuff placed around the urethra, connected to a pump that the patient controls to allow urination. Other surgical options include bladder neck suspension and urethral bulking agents, tailored to individual circumstances. It is important to note that while treatments for urinary incontinence focus on symptom management, they may be influenced by other conditions, such as bladder cancer. Some treatments for bladder cancer can impact bladder function and contribute to incontinence. Therefore, integrated management by healthcare professionals specializing in bladder health is essential. If you or someone you know is experiencing urinary incontinence, it is crucial to consult with healthcare providers specializing in urology or bladder health. They can provide a thorough diagnosis and a personalized treatment plan. Early intervention can lead to better outcomes and an improved quality of life. Always remember that treatments should be tailored to balance benefits and risks, guided by established medical standards.